Okay, so today we're really going deep. We're talking chest wall imaging.
Mm-hmm.
And you guys know we love to take these deep dives, and today is no exception. You've sent us some really interesting stuff from chestwallimaging.txt,
Yeah,
and I think it's going to be fun to unpack it.
definitely. This is a really interesting area
Yeah.
because I think people, when they think about imaging of the chest, they often go right to the lung or the heart, right?
Right. Right.
But there's a lot more to the chest than just those organs.
Right. What about the walls that hold it all together?
Exactly.
So the bones, the muscles, all of that.
And even the tissues
Yeah.
between the skin and those structures. So when we talk about chest wall imaging, we're considering all of those components.
So let's talk about the imaging then. I mean,
Okay.
we have x-rays,
Yeah.
we have CT scans, we have MRIs.
Right.
So help me to understand, for somebody who doesn't look at these every day, what we can see with each one.
Okay, so think about an X-ray as kind of like a shadow.
Okay.
It gives you a two-dimensional picture. It's good for some things, like if you're looking for a really obvious fracture,
Right.
or if you want to see, the general shape and size of the heart and lungs. But when you want to look at the chest wall in detail, that's when we turn to CT and MRI.
Okay. So tell me about CT then. What makes that different?
So CT stands for computed tomography. And basically, it uses X-rays, but in a much more sophisticated way than a regular chest X-ray.
Okay.
So it's almost like taking a bunch of X-ray slices, very thin slices, and then using a computer to put them all together to create a three-dimensional image.
Oh, wow.
Yeah, so you can see things in much greater detail. You can see the bones, the muscles, the blood vessels, all those layers really, really clearly.
So it's like looking at a loaf of bread, but you're seeing every single slice.
Exactly.
So where does MRI fit into this? Because you said we use both.
Yeah, so MRI is magnetic resonance imaging.
Yeah.
And unlike CT, which is really good at looking at dense structures like bones, MRI is better for looking at soft tissues.
Okay.
So think about your muscles, your cartilage, even your organs. Those show up much better on an MRI than they do in a CT.
So it's almost like two different lenses that give you different perspectives on the same thing.
Precisely. And the really cool thing is that we can take images from different planes. So we can look at the chest wall from the front, from the side, even from above. And we can put all of those images together to get a really comprehensive view. We call that multiplanar imaging.
Oh, wow. Like a 3D puzzle, but with your insides.
Yeah, exactly. And that helps us to make more accurate diagnoses and plan treatments more effectively.
That's pretty amazing.
Yeah,
So let's talk about why we might do this imaging.
sure.
Because our source material that you sent us, chestwallimaging.txt, it talks about all kinds of reasons why we might image the chest wall. And it could be something that somebody's born with, like a congenital anomaly. It could be an injury. Trauma, exactly.
Infections, tumors.
Infections, tumors. There's a whole range of things that could be going on.
Absolutely. And each of those things will look different on the imaging.
So let's start with the things that people are born with. You mentioned congenital anomalies. What are some examples of that?
Sure. Well, a common one is something called pectus excavatum, which people might know as funnel chest.
Mm-hmm.
And basically that's where the breastbone is indented. It kind of sinks in.
Okay.
And you can actually sometimes see that on a regular chest x-ray, but it can be tricky because it can sometimes mimic pneumonia.
Really? Wow.
So if you see something like that on an x-ray, you might need to do a CT scan to get a better look and make sure it's not something more serious.
So how can you tell the difference? What do you look at for?
Well, on a CT scan, you can see the shape of the breastbone much more clearly. You can see if it's really indented or if it's just the way the x-ray is positioned.
Makes sense?
And you can also see if there are any other abnormalities in the chest wall, like extra ribs.
Oh, right. You hear about people having extra ribs sometimes?
Yeah, they're called cervical ribs because they're located in the neck area.
Okay.
Most of the time, they're harmless. They don't cause any problems.
Okay.
But in some cases, they can press on the nerves and blood vessels that run from the neck into the arm. And that can cause something called thoracic outlet syndrome.
Thoracic outlet syndrome. What's that?
It can cause pain, numbness, tingling in your arm, and even problems with circulation.
Oh, wow.
Yeah, so if someone comes in with those symptoms and they have cervical ribs, we might do a special type of CT scan called a CT angiogram,
Okay.
which basically means we inject a dye into the bloodstream that helps us to see the blood vessels more clearly.
Oh.
And they can help us to see if the ribs are compressing the vessels.
That makes sense. So we've talked about things that people are born with.
Mm-hmm.
But what about if somebody experiences some kind of trauma, like a car accident or a fall? I would imagine that those kinds of things could really do a number on your chest.
Oh, absolutely. We see a lot of chest trauma in the emergency room. And imaging plays a crucial role in diagnosing and managing those injuries. Because you can have broken ribs, you can have damage to the lungs, even the heart can be affected in some cases.
So what kind of imaging would you do in a trauma situation?
Well, it depends on the severity of the injury. But often, we'll start with a CT scan because it can give us a lot of information very quickly.
Okay.
And it can help us to rule out any life-threatening injuries.
So you can see if there's internal bleeding, if the lungs have collapsed, things like that.
Exactly. We can see if there's a pneumothorax, which is air in the space between the lung and the chest wall.
Okay.
Or hemothorax, which is blood in that space.
Wow.
And we can see if there are any injuries to the heart or the major blood vessels.
So it's really like getting a window into the body to see what's happening in that moment.
Exactly. And that can be life-saving in a trauma situation.
Absolutely. So it sounds like CT scans are pretty crucial in these cases. What about after somebody has surgery, say, on their heart? Would they use imaging to see how things are healing?
Yeah, that's a great question. After any kind of chest surgery, whether it's heart surgery, lung surgery, or even just surgery on the chest wall itself,
right,
we use imaging to monitor the healing process.
Okay.
So, for example, after a thoracotomy, which is where they open up the chest to access the lungs or the heart, we might do a CT scan to make sure that there's no fluid building up in the chest, that the incision is healing properly, and that there are no signs of infection.
So it's almost like a progress report, but for the inside of your body?
Exactly.
That's incredible.
And it's especially important after heart surgery because the breastbone is divided during those operations.
Oh, right.
And we want to make sure that it heals properly.
Right.
Sometimes it can become infected or it might not heal as well as we'd like, and we can see that on a CT scan. We call that sternal dehiscence.
Sternal dehiscence. Okay, got it. That sounds kind of scary.
It can be.
Yeah.
But if we catch it early, we can often treat it with medication or sometimes even just with a special brace.
Okay. So it's all about early detection.
Exactly.
Catch it before it becomes a bigger problem.
Precisely.
What about infections? Can imaging help to diagnose those?
Yes, definitely.
Okay.
Chest wall infections can be tricky because the symptoms can be pretty vague. Someone might have pain, redness, swelling, but it might not be obvious that it's an infection just by looking at it.
Right, because those could be signs of other things too.
Right. So if we suspect an infection, we might do a CT scan or an MRI to see if there's any fluid collection, inflammation, or abscess formation. And in some severe cases, the infection can actually spread into the space between the lung and the chest wall, and that can be life-threatening.
Oh, wow. So what would you call that kind of a complication?
That's called empyema necessitatis.
Empyema necessitatis. That's a mouthful.
It is. It's a mouthful, but it's something that we definitely want to catch early because it can be very serious.
Wow. So we've covered a lot of ground here, from congenital anomalies to trauma, infections, but I think we need to talk about tumors.
Yes. Definitely. Yeah. That's a big one.
Tumors of the chest wall. Because I think when people hear tumor, that can be a really scary word.
Absolutely. It can be a very frightening diagnosis. And we'll talk about all that and more after a quick break.
Okay, so before the break, we were talking about how chest wall imaging can be used to diagnose everything from birth defects to infections. But now let's talk about tumors. I feel like this is where a lot of people get nervous.
It's understandable. The word tumor can be scary. But it's important to remember that not all tumors are cancerous.
Right. There are benign tumors and malignant tumors. Can you explain the difference?
Of course. A benign tumor is non-cancerous, meaning it doesn't spread to other parts of the body. Malignant tumors, on the other hand, are cancerous and can invade nearby tissues or spread to distant organs. Imaging plays a critical role in determining whether a tumor is benign or malignant and in guiding treatment decisions.
So how do doctors use imaging to figure out what they're dealing with when it comes to chest wall tumors?
Well, it often starts with a chest X-ray, which can sometimes reveal the presence of a tumor. However, to get a clear picture of the tumor's size, location, and characteristics, we rely on CT and MRI scans.
And those scans help determine if the tumor is benign or malignant.
Exactly. Let's say we're looking at a CT scan and see a tumor in the chest wall. Certain features can give us clues about its nature. For example, a benign tumor might have smooth, well-defined borders, while a malignant tumor might have irregular or poorly defined borders, suggesting it's growing aggressively into the surrounding tissues.
So it's like spotting the difference between a neatly planted shrub and a weed that's running rampant through your garden.
That's a great analogy. And just like with those plants, we want to identify and address the aggressive ones early on.
Makes sense. Now, our source mentions a whole bunch of different types of chest wall tumors. Do I need to go through all of them?
We don't need to get too bogged down in specifics, but it's helpful to understand that there's a spectrum of tumor types. Some are more common in certain age groups, while others tend to arise in specific locations within the chest wall.
Okay, so give me some examples. What are some of the more common benign tumors that doctors might encounter?
One of the most common benign chest wall tumors is an osteochondroma. These are overgrowths of bone and cartilage that usually occur near the growth plates of bones. They're most often found in teenagers and young adults.
And those are generally harmless?
In most cases, yes. But there's a small chance that an osteochondroma can develop into a type of bone cancer called chondrosarcoma. So we monitor them carefully.
So it's like keeping an eye on a mole that might be nothing but could potentially turn into something more serious.
Exactly. Now, another type of benign tumor you might come across is a bone island.
Bone island. What is that? Some kind of tropical getaway for calcium deposits?
Not quite. A bone island is a small, dense area of bone that shows up as a white spot on an X-ray. They're completely harmless and incredibly common. In fact, most people with bone islands don't even know they have them.
So why even mention them if they're so harmless?
Because they can sometimes cause confusion. Imagine seeing a small white spot on a chest X-ray. It could be a bone island, which is nothing to worry about. Or it could be something else, like a lung nodule, which might require further investigation.
Ah, so it's all about being able to distinguish between the harmless and the potentially harmful. But we focused a lot on benign tumors. What about the malignant ones? Those are obviously more concerning.
They certainly are. And one of the most common types of malignant chest wall tumors is chondrosarcoma, which we touched upon earlier.
That's the one that can develop from an osteochondroma, right?
Yes, although most chondrosarcomas arise on their own, not from a pre-existing benign tumor. They often originate in the cartilage of the ribs and can grow quite large.
And how are those typically treated?
Surgery is the primary treatment for chondrosarcoma, with the goal of removing the entire tumor, along with a margin of healthy tissue, to ensure that all cancerous cells are eradicated.
So early detection is key, just like with those benign tumors that might need monitoring.
Absolutely. Finding these tumors early, when they're smaller and easier to treat, significantly improves the chances of a successful outcome.
That makes sense. Now, our source mentions something called chest wall invasion. What exactly does that mean?
Chest wall invasion occurs when a cancer that started somewhere else, such as the lung, spreads to the chest wall.
So it's not a tumor that originated in the chest wall itself, but rather one that's made its way there from another part of the body.
Exactly. And this can be particularly challenging to diagnose because the tumor might be growing very close to vital structures in the chest.
And I imagine that makes treatment even more complicated.
Absolutely. Determining the extent of chest wall invasion is critical for planning surgery or other treatments like radiation therapy.
This all seems incredibly complex. It's like a game of microscopic hide-and-seek, trying to find these tumors and figure out their origins and intentions.
That's a very poetic way of putting it. But you're right, it highlights the importance of having skilled radiologists who can interpret these images and guide treatment decisions.
So we've got our CT scans, our MRIs, and even ultrasounds and bone scans, all playing a role in helping doctors understand the complexities of chest wall tumors. But tell me, with all this advanced technology at our fingertips, what are some of the challenges that doctors still face when it comes to imaging the chest wall?
That's a great question. And it leads us to an important discussion about the limitations of imaging. While these technologies have revolutionized medicine, they're not without their drawbacks. We'll explore those right after a quick message. Don't go away.
So we're back, and right before the break, we were talking about some of the challenges that can come up even when we're talking about these really amazing technologies for imaging the chest wall.
Yeah, and I think one of the things that people might not realize is that even with, high-resolution CT scans and MRIs, there's still an element of interpretation involved.
Oh, okay. So it's not like just looking at a photograph.
Right. It's not always a straightforward, oh, this is clearly this is clearly that kind of thing.
So there's some subjectivity to it.
There can be.
Yeah.
Two radiologists might look at the same scan and have slightly different interpretations of what they're seeing.
Really? Wow.
Yeah, so it really requires a trained eye to look for those subtle variations in tissue density, to spot those tiny abnormalities that could be significant.
So experience really matters.
Experience is huge in radiology, absolutely. The more scans you've looked at, the more patterns you've seen, the better you are at recognizing those subtle clues that could point to a problem.
Makes sense. What other kinds of challenges come to mind?
Well, another challenge is what we call incidental findings.
Incidental findings.
Incidental findings, yeah. Those are basically things that we see on the scan that weren't what we were initially looking for.
Oh, so like if you're looking for your keys and you find your sunglasses.
Exactly. Something like that. You might do a chest CT scan to look for a blood clot in the lungs, and you might find a small nodule in the lung. Now, that nodule might be completely benign. It might be nothing to worry about. But it can be hard to tell for sure without further investigation.
So what do you do in that kind of situation?
Well, it really depends on the individual case.
Okay.
Sometimes we can just monitor the finding with repeat scans. Other times, we might need to do a biopsy to get a definitive diagnosis.
So it sounds like communication is key here, making sure that the patient understands the risks and benefits of further testing.
Absolutely. It's really important to have a conversation with the patient, explain what we're seeing, and make a plan together.
Okay. Now, we can't talk about medical imaging without talking about radiation.
Right.
Because some of these scans, like CT scans, they use X-rays.
They do. And that's something we're always mindful of, especially with children or pregnant women, where the risks of radiation exposure are higher.
So how do you minimize those risks?
Well, we use the lowest possible radiation dose that will still give us a clear image. And we're always looking for alternative imaging modalities, like ultrasound or MRI, if those are appropriate for the situation.
So it sounds like you really have to weigh the benefits of the information you're getting against the potential risks.
Exactly. It's a balancing act, but it's one we take very seriously.
Well, that makes me feel better, actually, knowing that you're thinking about all of these things.
Oh, absolutely.
Because these technologies are amazing, but they're not without their drawbacks.
That's right. And that's why it's so important for us to continue to learn and evolve and improve so we can provide the best possible care for our patients.
I think that's a great place to leave it. Chest wall imaging, it's complex. There's a lot to consider.
There is.
But it's also pretty incredible what we can see now with these technologies.
Oh, it's remarkable how far we've come.
So thank you so much for taking the time to break it down for us today. That was really helpful.
My pleasure. It's been fun.
And thank you to all of you for joining us on another deep dive. Until next time, keep those questions coming. We'll be back soon with more fascinating insights into the world of medicine and technology.